But at the very late stage is when the patient will need dialysis or transplantation. Managing kidney disease is pretty expensive at that stage. So that's what I can say about it. Quite common, roughly about 1 in 10 individuals. And early stages are not that expensive to manage, but the very late stages are expensive.
Okay, so what are the causes of kidney disease in a person?
Okay, so if we look at the causes, the two most common causes are hypertension and diabetes. There is a third common cause in our environment. It has a very long name. It's glomerulonephritis. I'll try to explain what that is. It's a condition in which the body, in an attempt to get rid of maybe an infection or a condition that the body perceives as injurious, our bodies will, usually secrete what we call antibodies. There are times that the antibodies, apart from taking care of the invading bacteria, for instance, because of the similarity between the constituents of the bacteria and some parts of our body, the antibodies attack our organs, and in this case, the kidney, and can cause kidney damage. So that's a third one that is also very common. But there are other common conditions, or there are other conditions. For instance, a patient who has sickle cell disease is prone to having kidney failure. Infections such as HIV, hepatitis B, hepatitis C, even bacterial infections can cause kidney disease. Elderly men who have enlarged prostate, are liable to developing kidney disease. Some congenital problems with the kidneys, one of which is not uncommon per se. We talk about autosomal dominant polycystic kidney disease, where we have a lot of holes in the kidneys, and the holes expand and sort of squeeze out the normal kidney tissue. It's also something that we encounter from time to time. We've spoken about obstruction from prostates. Some other conditions can cause obstruction, like kidney stones, for instance. Also cause obstruction, yes. Some of the drugs we use, both the orthodox medicine drugs and the herbal preparations, they can also predispose to kidney disease. So some people believe that herbal drugs are natural, they don't cause any damage. Well, that's kind of a fallacy. So we've seen quite a lot of damage from such preparations.
Right.
So bandage. Yeah.
Are there any lifestyle choices that could perhaps make a person at risk of getting a kidney disease or any form of kidney diseases? Because I'm sure a lot of people have heard, if a person takes a lot of alcohol, they say, he could probably get kidney disease. Is this accurate?
Well, if you look at the conditions that I've listed, you realize that any condition that will predispose to a patient having diabetes, or a patient having hypertension, or social habits that will promote HIV infection, for instance. So any of those indirectly can lead to kidney disease. So if a patient is obese, for instance, morbid, very obese, that can lead to kidney disease, or can affect control of the blood pressure, can affect diabetes. People who smoke and take alcohol usually may not be too mindful of their health condition, and so may not adhere strictly to some of the measures that we advise them on. And but the most important thing is any patient or individual, I must say, who has any of those two common diseases must seek medical attention. So if a patient has hypertension or diabetes, and they are not, and he or she is not compliant with the medications, doesn't go to see his doctors regularly, doesn't attend clinics, not taking the drugs, that is a stage for kidney damage. And such individuals invariably will end up with kidney damage. And also taking drugs, buying over-the-counter drugs. Some, some, artisans, people deal with some kind of hard labor. And this habit of taking a lot of pain relievers, at the end of the day, after the day's work, they go to the chemist and they get a lot of mixtures of pain relievers. They call it a cup or some kind of names like that. The effect of that is damage to the kidney. We see some kidney damage resulting from such habits. That usually happens slowly. So that individual may not even be aware that it's slowly and gradually damaging his kidneys. And invariably, they end up with very severe kidney damage. And these are the people that are not really able to afford the treatment, for chronic kidney disease, especially the end stage kidney disease. And so in all individuals, it's better to prevent kidney damage than to aim for treatment at a later stage. So there are obviously health habits that affect the way kidney disease presents. So.
Awesome. Thank you, Prof, for giving us the overview and insights. We'll go on a quick break, and when we return on the other side, we'll continue the conversation as we delve into the process of organ donation here in Nigeria. You're listening to Lagos Talks on Smooth 98.1. Stay with us. We'll be back on in just under 2 minutes.
Okay.
Yeah, I don't know. I'm trying to fade it and it wasn't fading. This is Ponzi scheme calling me.
So all the year is back for its state season. Thrilling moments. On African urban they connected to DSTV and Go TV, Nigerian Idols, sponsored by Digi and Techno. Why buy a house when you can rent? Why buy a spacious home in Paradise Towers or even data community of like-minded people? When you go one further, new connections. Why wake up to extensive breathing and picture instead of that? Use your kids in a safe and secure community where they can have what average kid has. That's because you have standards and refuse Them. On your standard bet, call 0803-331-1507 at Digital Mall at Paramount Twin Towers, Holyrood, and save 20%. Terms and conditions apply. Paramount Twin Towers, Holyrood is a project of Alton Morgan Goldings.
Okay, so we're set to go on. You're listening to Lagos Talks on Smooth 98.1. It's Zibby here, and we're talking about kidney disease and the organ donation process in Nigeria. Our special guest, the Professor of Medicine, consultant nephrologist from Lagos State University Teaching Hospital, Professor Jacob Awobusuyi. Thanks for being on the show, Prof. So we've spoken about kidney disease in Nigeria, symptoms and challenges, but let's get into the legal part of organ donations, and this is the end stage, sir, just to confirm that.
Yeah, that's the end stage. Yeah, that's most of the time being talked about.
So what legal framework actually governs the transplant process and the donor process in Nigeria?
We have the National Health Act of 2014. I think the Part 4, Section 7, 8, and so on, actually deals with the process of organ donation and also transplantation, not only the kidneys, but also other organs and tissue in the country. We in Lagos State, we have actually been trying to get a bill passed into law, which also deals with organ transplantation in Lagos State. I think it's presently in the national, that's in the State House of Assembly. And essentially what this bills and then the act dwell on is the process, the responsibilities, the governing oversight by the government, and then the responsibilities of the individual institutions, and the way we should, approach organ transplantation for any individual. That's organ and tissue, transplantation for any individual. It permits the removal of organs from individual for these purposes of treating patients that are affected with end organ damage. As I said, it's not just only the kidney. We also have other organs that can fail. So what applies to the kidney more or less applies to organs, such as hearts, such as liver, lungs, and also tissues, talking about tendon, talking about cornea in the eyes, talking about bone marrow transplants. So there are quite a number of organs that could be transplanted. So the act makes it legal, provided it's used to alleviate the suffering of individuals who are afflicted with diseases of those organs. It also permits the removal of organs from a deceased human being, a dead human being, which may be a subject that we can talk about maybe we can talk about it today, but it's something that is quite interesting. because all over the world, people make use of organs from dead human beings. But we understand that there are quite a number of hurdles that we might have to cross, in Nigeria to be able to effectively put that into practice. So we have the National Health Act, really. So that has been in place since 2014. Okay. Then we have the Declaration of Istanbul, which actually makes it illegal for you to trade in organs, for you to I think that's one of the things that the senator actually contravened, because Nigeria is or has been a signatory to that Declaration of Istanbul, which makes trading in organs very illegal. And the reason is that you cannot attribute an organ, cannot consider an organ from a human being as a commodity. It's not salt, or it's not gari, or and anything that you would like to trade in. So it's illegal for you to buy an organ. And because if you look critically at people who buy organs, who trade in organs, you will see that the organ will come from a disadvantaged individual. And most of the time, the transaction is sort of exploitatory in nature. You take you pay, I don't know how much the young man says he was offered, and then you wonder how long will that sustain him.
About £6,000, according to
how much
reports.
£6,000, in terms of naira. Can he build a house? Can he establish a good business that can sustain him? And so that exploitation is one of the aspects. And the other aspect is, most of the time, those individuals are not provided with sufficient information about the consequences of donating the organ. They just assume, yes, I'm going to be paid £6,000. Converting pounds to naira might make it look very, very make it a large sum of money, but in the real sense, that's not the kind of money that such a patient encourage at all. We don't encourage such.
And, so if a person donates an organ, say a kidney, in this case, to someone else, perhaps a family member, will they require lifelong care to go about to have a healthy existence after donation? Or is it something that they can just recover from after a while and go on to be fine?
Well, let me say, donor is not a patient. We've seen people who have donated their kidneys and they've gone ahead to be Olympic champions. We have a lot of people who have donated their kidneys and they're actively involved with very strenuous sport. We have people who have donated their kidneys 20, 30 years ago, and they are without any problem whatsoever. Now, the thing about donating and kidney transplantation is that before an individual donates, we screen the individual thoroughly, and sympathy is towards the donor. So the first thing is, does this patient or does this donor understand what he or she is, going for, that a major surgery is going to be performed. An organ, which is a major organ, is also going to be removed out of the two that he or she possesses. Does that individual understand the full implications of that? Then we now screen the patient thoroughly. We examine the patient. Does he or she have any condition that can affect the surgical procedure in terms of the outcome, the immediate outcome of the surgery? Does the individual have any condition that can jeopardize his or her health in a foreseeable? Found that there are some attributable risks to donating. The blood pressure might be a little bit elevated, but that's a long-term consequence. Looking at 15, 16, or 15, 20 years consequence. But we think those attributable risks are acceptable and they're minimal in terms of what the patient stands to benefit. And if you look at published literature on donors who have sort of expressed the way they feel after donating their kidneys, most of them actually feel better in that they feel that they've done something significant, something important in the life of the patient, saving the patient. We call it a gift of life. So they've really helped another human being. So that's psychological satisfaction, which we cannot quantify, is very much prominent. And whatever domain of quality of life that one looks at it from, you find out that it's always there, it's always present, it's quite obvious when you talk to the donors. And many of them would do it again if it were possible.
Right.
So we understand that there are some attributable risks, but we believe that those attributable risks are minimal and the benefits outweigh the risks.
All right. Prof, how are potential donors identified and screened in Nigeria? And is it the same process in the UK from your experience?
Okay, yeah. In Nigeria, we have a living donor kidney transplantation program, and that's the only program available in Nigeria. In the UK, we have both the living donor program and the diseased donor program. I can talk about the two of them. Take the living donor program. The donor can be your relative, maybe parents, children, siblings, uncles. So those are direct relatives. But can a non-relative donate? It's possible, provided that such non-relatives are not providing the organ with financial inducements, and also whether the patient is a relative or someone that is not related, that person is not giving the organ under pressure. So you cannot say because this is my wife or my child and I need an organ, I need a kidney. The donation must be a voluntary choice of that individual. So you cannot force, the patient to donate. In our program in LASUTH, we actually ask the donor to see a clinical psychologist who will examine the donor and interview and have a session with the donor to ensure that there's no identifiable sign that this individual has been put under duress, has been put under pressure, and that the potential donor understands what the process is like, what is going to under the surgery, the fact that will be required to see us at regular intervals, so that just to monitor him. Most donors don't have problems, so the individual must be in full picture of what is going on before he or she donates. And then besides that, we have sessions with the donor, during which we also provide all the information. It's a full disclosure. There's nothing.
No one is left in the dark.
No one is left in the dark. So the patient has the full information, and then we also, the donor, and we expect the donor to make a voluntary consent, voluntary and informed consent. So there are two aspects to it for it to be valid.
Yes.
It has to be full, that's informed. The patient needs to understand what he or she is going to, will undergo, and also that's the information, part of it. And then he needs to consent after that, and so those are important in terms of providing a valid, informed consent, for any procedure, any surgical procedure, and most medical procedure. So it has to be an informed consent from the donor. And so, apart from that, we now go to the investigation aspect of it. We ensure that the donor has two kidneys. The two kidneys are working perfectly well. He or she doesn't have any disease condition that can adversely affect him in terms of some kind of heart disease, in terms of diabetes, for instance. We won't allow somebody who has diabetes to act as donor because it's one of the conditions that can cause kidney disease. A patient that is hypertensive, at times we permit them if hypertension is mild and it's only controlled by one or also drugs, because we know that the risk of developing kidney failure from such is not that there's no risk, but we believe that the attributable risk is accepted.
Okay, we'll take a quick break, and when we return, we'll continue the conversation. We're talking about the kidney disease and organ donation process in Nigeria, and this is coming off the Senator Ekweremadu incident. Him and his wife have been found guilty on organ trafficking charges in the UK. Stay with us. We'll be back in just a few seconds. We'll be back on in 30.
Okay.
Thank you, sir.
Yeah, okay.
It's magic with Costco. What you need? Thank you. Chosen one. In the whole new Showmax original TV, now available only on
Animation.
Subscribe from 1,200 naira a month. Sign up at showmax.com.
Okay, coming on. You're listening to Lagos Talks on Smooth 98.1. It's Zibby here, and we're talking about kidney disease and organ donation process in Nigeria. Our special guest is from the Lagos State University Teaching Hospital. He's a professor of medicine and consultant nephrologist, Professor Jacob Awobusuyi. Prof, before we went on the break, we spoke about the identification and screening of potential donors in Nigeria. Now, when it comes to the allocation, how are organs allocated to patients who find that they're in need of transplants?
When you talk about allocation, principally you are looking at diseased organ donor transplantation program. As I said, we have just live donors in Nigeria, so you cannot get organs of an individual to another individual. So the patient brings his or her donor, and the transplant team sort of evaluates the donor, and if the donor is found eligible, then we allow the donor to proceed. When it comes to organ allocation, it deals with diseased organ transplantation, in which you have a waiting list of recipients, patients who have kidney failure and on dialysis are put on a waiting list. There are scoring criteria, for the allocation, like how long has this patient been afflicted with end-stage kidney disease? How long has it been on dialysis? What are the special circumstances? For instance, is this patient highly sensitized that will make him or her, make it difficult for him or her to have, donors in the program, readily? And a couple of other things are taken into consideration. So you have this waiting list. There's number one on the list, number two, number three, number whatever. And so if an organ becomes available, if let me say somebody dies, unfortunately, and the organ is available, so based on the list, so the organs are allocated. A single individual, a single diseased individual, can save about 8 lives. I mean, that's the issue about diseased donation. And so the organs are allocated based on the criteria. Well, it's similar in most countries, but there are differences. I mean, discernible differences, and each country tries to do the list. There's a transplant list, and we have different sets of criteria what the transplant program considers as important.
What would it take for Nigeria to have a system of this transplant list, or just like you said previously, the deceased donor scheme?
Yes, kind of an equitable way, and justice also comes into play. And so there are set of criteria that ensures that nobody is cheated, so to speak. I put that in what I call, and that's the program benefits all that need organs, and individuals who get transplanted, will actually know. I mean, everybody will actually know that this process is
Prof?
That's transparency is very important. The whole system, is hung on public trust. So public and professional trust, come into play, and nobody wants that trust to be betrayed, because any betrayal of that trust can jeopardize the success of the program. Because if patients don't trust you, or other doctors who are not part of the transplant program, if they don't trust you, they're not likely to, participate in such a program. What do I mean by that? Let's take it from the doctors. We are talking about disease donor transplantation. The donor comes from an ICU, that's an intensive care unit, or a critical care unit. While on life support machines, yes, on ventilators, and at one point they have they have brain death, so their brain dies. When the brain dies, other organs can still function, provided we maintain them. That's we maintain the body on life support systems. We provide oxygen by ventilating the patient, breathing artificial respiration for the patient. We maintain the blood pressure by giving drugs. We provide hormones that are required to maintain bodily function. So we can still sustain that individual for some time. And it's such people that actually organ donors, not the person that dies on the road and brought to the hospital a couple of hours afterwards. I mean, the organs of such a person actually is of no use to patients, because a lot of clotting would have occurred in those organs, and the organs are actually dead by the time the patient comes to the hospital. So patients who, don't let me say patients, because there are no more patients, they are dead individuals. And we have this dead donor rule that stipulates that all donors must be certified dead. I mean, I'm just sort of making it simple in a way. So we cannot say a patient is in coma, and the patient that is in coma that is used. It is the dead person. There are ways by which we can certify the brain dead, and that process must be followed to the very last detail. When you're certifying, patients dead for the for the purpose of organ transplantation. So, and nobody that has ever been certified dead ever comes back to life, even when there have been court cases, delays. That dead individual had been maintained on life support. So there had been no case that the patient regained consciousness. Cases where we, the papers, some of the past few instances where they say, well, the patient came and regained consciousness, are not people that have been certified dead, in terms of using the brain death criteria, because there are sets of criteria that we know. So the individuals, individuals that are used are dead individuals, and so we have very strict medical criteria for ensuring that nobody that is alive is taken for being dead.
Right.
Transplanted. So they have some.
Okay, Prof. We're almost out of time, but I have to ask one last question. What could Senator Ekweremadu have done differently for his daughter in this situation that he's now being found guilty of?
Well, I think there are a couple of options that are available for him. The first is to actually ask a relative, maybe himself or the wife or the siblings of the daughter, to donate, and voluntarily, even as a brother. If you don't want to donate, you cannot be forced to. And so if you could have taken that road. The second one is that the daughter is having dialysis in the UK, and the UK has a disease donor program, running, and so she probably is on the waiting list with the criteria as I made allusion to. So it takes about 3-4 years to get transplanted, and dialysis over there is regular, and in this case, the financial aspect may not be what will hamper the daughter having regular dialysis. So that option is also there, available. As I said, the legal laws and principles, whether you are in UK or in Nigeria, it's binding. An organ is not a commodity, so you cannot sell or buy an organ. The law is against it. So you are committing an offense by buying an organ, or even attempting to buy an organ, and also by selling the organ. It's also an offense. So we shouldn't mix sentiment with what is legal in terms of violating the autonomy of another human being, which is the young man in question. So I think the senator ought to have taken those routes. Either asking the girls, brothers or sisters, himself, if he doesn't have any disease that make him not eligible to be a donor, or any of the relatives, or waiting it out for when an organ will be available. One sympathizes with him. I mean, it's possibly to have been done out of ignorance, and the consequences are just what we're seeing.
Mm.
But let's just leave it at that.
Awesome. Well, thank you so much, sir, for being on the show this morning, and thanks for sharing your knowledge and your experience as well with us. Thank you so much.
You're welcome. Yeah. So, a very great day. Hi.
Thank you, sir. And I wish you a pleasant day as well. That was our guest, Professor Jacob Olugbenga Awobusuyi, Professor of Medicine from the Lagos State University College of Medicine and consultant nephrologist, Lagos State University Teaching Hospital, LASUTH. Now, World Kidney Day was on the 9th of March, and experts said no fewer than 45,000 Nigerians die yearly owing